Hey guys, Dr. Davin S, board certified laser dermatologist. Today we'll be talking about a concept that's very important to understand. It's called your skin threshold. Everyone has a unique threshold and it's very important to actually find yours for the reason that your skincare and even things like, for example, chemical peels, lasers, all those sort of, therapies can be adjusted according to your threshold. For example, if someone has very sensitive skin, given an example is someone with atopic dermatitis, eczema, seborrheic dermatitis, or even things most commonly like rosacea. These patients usually have a much lower threshold for irritation compared to someone who has resistant skin, for example, oily skin. Now, the threshold can actually vary with different things. Yeah? For example, there may be seasonal change. Winter, for example, your threshold decreases. If you go to another country which has lower humidity, that can actually decrease as well. And also, certain times of your life, your threshold will decrease or increase. For example, if you're using lots of products when you're, in your 20s and you don't know much about skincare, your threshold might be very low and often increases when you're in 30 or 40 when you're more selective. Additionally, when you grow out of certain skin conditions, for example, atopic dermatitis, eczema, or even if your rosacea is under control, your threshold increases. So let's look at why understanding your threshold is very important. The reason being is that we all like to use skincare with actives so that we're actually doing something good for our skin. But are we really? If you have a very, very low threshold, right? For example, someone, like I said, with rosacea, and you start using the wrong product as your primary your primary active. Give you, for example, ascorbic acid or vitamin C. Ascorbic acid is actually best formulated in a pH of somewhere around 2 to 2.5 for maximum absorption. What that means is that you're putting an acidic product on your skin. As a result, your threshold decreases. When you decrease that threshold, what it means is that when you use a secondary product, for example, retinol or retinoic acid, what you're doing is that addition of that product will actually make you have skin irritation because your threshold's been exceeded. Now, this is where calculated skincare comes in, because if you do suffer sensitive skin, my view on this is make everything count, which means if you're using things which irritate your skin and your gain is small, don't use it, because all you're doing is you're decreasing your threshold for more important things. That's why most dermatologists will actually suggest the first thing we use is sunscreen. Most sunscreens should not affect your threshold, especially physical sunscreens. Titanium dioxide, zinc oxide, certainly those are the ones that are more inert. Second thing which dermatologists always advise you on is a form of vitamin A, whether it be retinol, retinoic acid, or some form of retinoid. Now, if you use a retinoid, there's a 100% chance that your threshold will decrease because the actual biochemical and the physical activity of the retinoid is to actually cause compaction of skin, but not only that, it can actually increase the amount of skin sensitivities. It can actually cause angiogenesis, in other words, increase the amount of blood vessels, and that's why you can have that retinoid glow. So that's why when you're actually using retinoids, we've got to actually make sure that your skin can tolerate that and the threshold's not exceeded. I've done quite a fair few videos on how to use retinoids. I've also done many countless Instagram posts. So if you're not following me on Instagram, consider, because it just gives you that really 1 to 2 minute snippet in regards to a particular product or skin condition. So enough about retinoids, yeah? So when we're talking about skin thresholds, other things which we can use, things like, for example, vitamin B3, niacinamide, because that does not reduce the threshold as much compared to, for example, ascorbic acid. Other things that we can use that's good for our skin include, for example, alpha hydroxy acids, whether it be glycolic acid or lactic acid, or if you have acne-prone skin, things like salicylic acid. So the bottom line is this: understand your own skin. Yeah, understand that when you actually put a product on, when you're actually putting an active, ask yourself, why are you doing it? Is it because you've been sold that by someone in the cosmetic counter, or is it because you've got a problem and you want to actually have a solution? That's how you should actually approach your skin threshold and understand the first 1 or 2 products which you put on as part of your skincare regime or your skincare routine make sure they count, because every other product after that, you're going to decrease your skin threshold until you get skin irritation. So what do you do if you get skin irritation? That's pretty easy. What you want to do is back off on everything. Yeah. So if you're using a whole heap of different cosmetics, you want to back off everything. Use something like a simple cleanser, a simple moisturizer. Even stop sunscreen for 2 or 3 days, because we need to actually get your skin barrier to improve and to repair. Thereafter, pick up your product, right, whatever one you're using, and you can do a little test spot. So test spots can be done behind the ear, or repeat application tests, open application, also known as a rote. You can do it in your forearm or even in front of your ear. Yeah, and that way you can actually understand how that particular formulation reacts with your skin. If you can tolerate that, certainly you can add more and more frequently. Yeah, so maybe start 2-3 nights per week, use as tolerated, and increase as tolerated. Thereafter, reintroduce 1 or 2 products at a time. So it may take you another 3 to 4 weeks till you understand or get a better grasp of what your threshold is. But from there, it should be pretty easy. Guys, I hope you liked that video. It's just a short video on something which I think is very important, because if you can actually understand the fundamentals of skin and skin thresholds, you'll get a lot more in the long run. Guys, please comment, share, and if you're not subscribed, consider that. Bye for now.